Hello and welcome to Work University. I'm Annalisa Felix. I'm always asking people why they do what they do for work and how they got there. So I figured why not share this information? So thanks for listening and let's dive in. I am here with Michelle, and Michelle is a nurse at a local hospital, and so what we're going to talk about is how you got into the nursing field. So did you always want to be a nurse, or was that your lifelong dream as a kid, or how'd you get into that profession?
Well, it's always been my passion to be a nurse. I have a lot of family members in the medical field. I originally wanted to go into the military, the Air Force, and be a doctor in the Air Force. I graduated pretty early, around 17, and I trained. I took the test for the ASVAB test for the Air Force, got in, but I was too young to go. So I had my dad sign a form, and he would not sign it. So at that point, I just picked college, university.
So you decided to go to a university to get your nursing degree? And then
Yes.
What was your vision after that? You wanted to be a nurse in a hospital, or what did you envision doing after you received your degree?
Well, I only planned to go to Cal State for 1 year and then go into the military, because once I was 18, I was able to go.
Okay.
But I never looked back.
Okay, so once you started the nursing degree, it just kind of ended up you were going to finish there.
Right.
And get into nursing.
I loved it.
Oh, okay.
I loved school. I loved everything about the college I went to, and I just pursued that route.
Are there different types of nursing degrees, or?
Oh, there's a whole bunch of nursing. There's anywhere from MA, from CMA, from LVN.
What's MA, Master's?
It's a medical assistant,
Oh, okay.
certified. Then it's medical assistant, certified medical assistant. It's a licensed vocational
Okay, so
nurse,
there's a bunch.
RN, BSN. Yeah, nurse practitioner. You can go the limit. You can see your own patients.
Oh.
Oh yeah.
Wow, okay. So I didn't know that.
PA, physician's assistant. You can continue.
So those are different four-year degrees? Or
They're actually at a private school. So once you get your BSN or your associate's degree, then usually you start working at like an urgent care or retirement home, somewhere to get your feet wet, because you need experience.
So do they have internships while you're still
Yes.
attending school? Okay.
Yes, you have internship. I am also an X-ray technician, so I have my license for limited X-ray technician. So that's where I started in a hospital.
Okay, so how many years did you spend for your degree?
Total, about five years.
And anyone can do that like after high school?
Anyone can do that after high school.
You don't have
Yes.
to get an associate's and then get
No,
in some kind of
what I would have done is done it totally different.
Okay.
I would have graduated high school and went to a trade school for 2 years.
knowing what you know now.
Yes,
Okay.
I would have went to a trade school, got my license within like a year and a half, started working, making money, because hospitals will hire you and train you if they like you to do a job. They'll
So-
pay for school.
So if I go to a trade school for a year and a half, or go to a nursing degree school for 4 years, am I still going to get paid the same but just earlier?
Yes, because you will have the job skills that they are looking for. If you go to a 4-year university and don't have any work experience, they're going to look at the other person that has had some nursing training with patients, and they're going to hire that person for less, pay them less money, and then put them back in school because they like them.
So when you're doing the internship thing, the who you know factor jumps in a lot earlier as well.
It's not always what you know, it's who you know.
Okay. So after you got your degree, did you have a lot of time between the degree and the job, or were you able to jump right into something?
I was able to jump right in because I took a job that was very low paying in a retirement home, all the way in Thousand Oaks. I didn't get paid much. It's not all glitz and glamour. You have to do the nitty gritty. You have to change diapers, you have to clean up vomit, assist the nurses with medications, whatever they need you to do, you do it because you're in a learning environment.
Well, do you ever run into your fellow nurses who tell you that they thought it was going to be a different situation?
Yes.
Okay.
Yes.
And did you think it was a different situation?
No, because I started in a retirement home, so I knew exactly what I was getting into.
Okay.
I started at the bottom. People that start at the top and then have to go to the bottom, they're not prepared for what's in store because everybody needs geriatric training, which is the process of getting old. You have to learn how to deal with irate patients, young patients. We're not going to stay healthy forever. We're going to be in diapers, we're going to be with dentures, all that stuff. So the earlier you know that and you're able to deal with those irate patients and calm them down, because there's all forms of patients. So the earlier you have that training, the better off you're going to be as a nurse.
So you would suggest that everybody gets the geriatric piece in there at some point, preferably in the beginning, because that's like a boot camp.
Yes.
Okay, because after that you can do anything?
Yes.
Okay.
Especially like dementia patients, Alzheimer's patients. Those are very difficult patients.
Sure.
They're angry. They're not the most pleasant patients
Sure.
to work with.
Right. And so this is where customer service
Yes.
comes in. And so if you're not a patient person by nature, do you ever run into those kinds of employees or fellow colleagues that perhaps has a harder time?
Yes. I see it a lot.
Okay.
I see a lot of young nurses come in and think it's one way when it's not.
Right.
And so the compassion is not there. You have to have a passion for what you do. You have to go in there expecting nothing and giving it your all every single day.
That's hard to do in any situation.
Yes.
And how have you been able to do that? Is that something you've had to work on, or is that something maybe you've learned? Because
I learned it really early because I was not supposed to be here. I was born premature.
okay, so it goes back to
It goes back to other things.
Okay,
Yes.
Yeah. Okay, so if you don't have it innate, then hopefully it's something you can learn, and if you don't, it sounds like you're gonna have a harder time
Yes.
in this. Okay. All right. So after you did your geriatric time in your, where was Sherman Oaks or Thousand Oaks?
Thousand Oaks.
Okay.
It was for about 1.5 years, almost 2 years. And then I got picked up doing x-rays at Tarzana Hospital in the Valley.
Did you have your X-ray training before
Yes.
you started?
Yes.
Oh.
I had just graduated. I had just finished. So I was in school finishing up my my nursing, and I went to school for 1.5 years for my X-ray.
Oh, okay.
So when I did my X-ray, I got hired at Tarzana Hospital to take X-rays.
Is that a certification on top of your nursing degree?
Yes.
Okay.
Yes.
Which is great to have in your toolbox.
Yes.
Okay, awesome. And so do you have to do X-ray stuff now, or are you in a situation, or wait, maybe we jumped over some things. So what did you do after you got that X-ray tech position?
I worked orthopedics for about 3 years.
And what does that cover?
Orthopedics is basically your bones, your skeleton, your back, your knees. I did sports medicine, so I worked with a surgeon that primarily did surgeries on patients that were injured during sports, football, baseball, those kind of things.
Were
He was
you
a
in
sports.
the surgery, or were you like more?
No, I was mostly in the clinical side of it, and taking X-rays and
Okay.
injections. Doing taking out fluid. When your knee gets all swollen and stuff, assisting the doctor,
Okay.
taking out the fluid and giving injections and stuff like that.
Okay. So after that, then what?
So after that, of course, you want more money and you want to make more money doing less work. So I went to UCLA.
Oh, okay.
So, yes, I went to UCLA Hospital for about 5.5 years.
Okay, and what kind of nurse were you there?
Internal medicine and pediatric.
What does that mean for the person
So,
who doesn't know?
internal medicine is like your family practitioner. They deal with everything from like headache, sinus, diarrhea, back pain, everything. That's your family doctor you go to. That's
Like
your
a PCP.
That's your primary care, your PCP. This doctor had a double major in internal medicine and pediatrics. So she did both. She was licensed to see from babies, from newborns, all the way to 100-year-old patients.
So did that like double the amount of people you brought in?
Yes.
Okay.
Yeah.
And that was at UCLA. Is that on campus?
It's on campus.
Okay.
Yeah.
All right. And so how long were you there?
Almost like five,
5.5?
5.5, almost 6 years.
Okay. And why did you leave there?
It was too long of a drive. I live in the valley,
Oh, okay.
so it's about
For
an
those
hour.
of you who don't live in the valley, the drive is geographically maybe 10 miles, but it's about an hour and a half.
Yeah, yeah, and the only
I
way
don't
in
blame
and
you.
out is like the 405.
Yeah.
So you're driving on the 405, you're leaving extra early, you're trying to get there, and one way was an hour and a half.
And having a nursing position, it doesn't sound like there's much flexibility because you have to be there from a certain time to a certain time, correct?
Yes.
Okay. So you spent the time there, and how would you say you grew with that? That sounds like a boot camp in itself?
It was very challenging and very demanding, and there was a lot of work. The pay was great,
Okay.
amazing, but it was a lot of work.
Okay. So after then what?
Then I came
To where you are now.
to where I am now,
Okay, great.
and I've been there ever since, and I don't plan to leave.
Okay. And I'm sure it helps when you have, a physician that you get along with, or you have, so for
Every physician is different. Every doctor is totally different.
Right.
They have different demeanors, they have different attitudes. Certain doctors want certain things done one way, and if you're not that way, then they will just you guys are not compatible.
Right.
You have to have a nursing doctor relationship.
So would you then recommend that people looking for a nursing job really interview their doctors and really make sure, like dating, you want to make sure,
is it good for you? Is it good for
Yes.
me? Is this gonna work? Okay.
But if you need work experience, you should work with an array of doctors.
Yeah.
Every doctor that you're interested in. Because every specialty is different. Every doctor does different blood tests. There's different tests that they do for certain illnesses. So every specialty doctor is different. They're not all the same. It's not one specific test for every single patient. Every specialty is different.
Okay.
so for those people that maybe are coming out of high school wanting to be a nurse, or even later in their careers thinking, oh, I've always wanted to get into the medical field, what would you tell them as like a piece of advice?
The best piece of advice I could give them is know what you want to do early in life. Go after it. Do it with perseverance, with a passion, with a flame in your heart, and you're going to be exceptionally. You're going to stand out among all the other nurses. You're going to go the distance. It never seems like work. When you love what you do, it doesn't seem like work. The days just feel like you're making a difference. You're helping a person. You can see the passion in a nurse's eyes when they really love their job. It makes you want to come back. It makes you feel welcomed and able to open up and trust them.
Right, and that's so important. As and if you look at it, you're a customer. Somebody walking in off the street is a customer going in for assistance, and if the customer service coming back is not, delicate, I'm sure that can disrupt the whole experience.
Right.
On top of the fact that you're not feeling well.
Right.
So, I know I notice customer service issues here and there, and I've talked to you, and I'm really impressed by your take towards that aspect of it, because if you look at it, it's a business. It's just like anything else. There's paperwork. You got to go every day.
Right.
But it's one of those more human interactions. So I commend you for having that attitude towards it, because, if everybody did, it would be a different place. But, that also puts you in a situation where you can help others and, make them feel good and ease them, when they're nervous or anxious at times
Right.
as well. So,
And your word means a lot. If you say you're going to call back a patient, you make it a point to call that patient back. If the patient is having issues and problems and needs something done right away, you have to learn how to prioritize and juggle it. And you have to say, give me 5 minutes, I'm with a patient, I will call you back, and just do it. Your word means a lot to these patients and to your doctor. Your doctor has to be able to trust you because he's not there all the time, but you are. So the work needs to be done in a timely fashion, and it has to be efficient. If you're not efficient and he can't trust you, then you're not going to go far.
how many patients do you see a day?
About 45 patients.
Okay.
Yeah.
And, what percentage of those on the regular are in an uncomfortable feeling, like will give you a hard time?
I would say maybe about 3% of the
Really?
patients.
Really?
I have a way to kind of calm them down and put them at ease. I haven't dealt with a very irate patient only if they are mentally unstable, if they have dementia, Alzheimer's, because they really don't know what's going on. So they feel threatened, they feel intimidated by you, like you're going to come at them and lock them up in a place, and that's not true.
Okay, now in addition to the human talking to and taking blood and that type of thing, how much administrative work is there? How much paperwork, say, per one person is there? Like, because that's
lot.
not something I think about as a patient.
A lot. Most of insurance companies, they don't cover your medications anymore. So you're on the phone early in the morning trying to get prior authorizations for medications. You're trying to make sure that their referrals are coming in so they can see specialists. You're trying to get other records from other previous doctors so the doctor can treat them the best of their ability. You're on the phone constantly back and forth with the patient, emailing the patient, other doctors, other doctor pre-op stuff. It's a lot of administration stuff.
So does your day just fly by?
Flies by. You come in, you clock in, next thing you know, you're lunch, and next thing you know, you're going home. That's how it feels.
Okay.
And it's fast paced.
So, what else would you say out there in closing, before I ask you my last couple of questions, to those who, or even people, what would you say to people going in as a patient to remember, like as a nurse, if you want people to know something, hey, just remember.
Hey, we're all human beings, and we all want to be treated with respect, compassion, and love. And, you may not feel well. I may not feel well. I have a lot of things going on in my personal life, so does a patient. But you go in there, you put on this smile, you make them feel comfortable, and it's a relationship that you establish with your patients. They're not just your patients. At the end of the day, they're human beings. They're your friends. They need help. You want to make them feel better, and you do everything possible to make that happen.
And sometimes you're not feeling your best.
Right.
You have issues too.
Right.
Your kids are sick or whatever.
And you're sick, or you're not feeling, you're a little under the weather or whatever, and you just go in there and you give it 150% every single day.
Wow. Interesting. Thank you. So I'd like to close, but first I want to thank you for, sharing your experience with us, and hopefully this will help somebody get a glimpse in, the nursing field, to get to know it better, because sometimes people may think that nursing is one way. When you actually get there, it's different, or maybe, they can take some information and, give it to somebody else and help them decide if they want to become a nurse. So,
Absolutely.
thank you so much for helping.
You're welcome.
And we'll see you all next time. Thank you. Thank you so much for listening to Michelle and I talk about her journey to becoming a nurse in internal medicine. If you have any comments or questions, please leave them in the section below. And until next time, take care.